I have come across many patients who inquire about how to switch off their brain at night and fall asleep. Most of insomnia patients report racing thoughts before bedtime that keeps them awake. Furthermore, some of them even complain of waking up frequently at night and being unable to go back to sleep due to the ruminating worries, anxious feelings, thoughts and memories that keeps them awake. Have you ever wondered how your brain knows when it's time to be awake and remain alert and when it's time to sleep and how it does this? Hello friends, welcome to this session. I am Dr. M. Singh and today I will be discussing various nerve centers in the brain that work like a switch. This switch helps your body stay alert during the day and fall asleep at night. Some introduction is as well included about the control systems for non-REM and REM sleep stages. Let's dig deeper into the wake sleep control systems or centers or switches. There are two mechanisms which regulate sleep. The homeostatic body system, it regulates the intensity or depth of sleep achieved, whereas the circadian clock, which is related to the light and dark exposure during the day and night respectively, regulates the timing of sleep. Let's first talk about the awake switch. Switch with a circuit, also called the ascending reticular arousal system, ARAS. This system keeps us alert, focused and responsive during the day. It works by controlling sensations to be passed on to the brain and by releasing chemicals or neurotransmitters that stimulate the brain and keep us aware of the surroundings. The ARAS is in the brainstem and is considered as one of the most important systems which facilitates awareness of sensation and attention. This is made up of a net-like bundle of nerve cells or neurons. Anatomically, this system in man is about the size of little finger and is located at the core of the brainstem, just above the spinal cord and extending up to below the thalamus and hypothalamus. Several brain chemicals help turn the switch on. Together, these chemicals help the brain stay alert, active and responsive. The ARAS is active when we are awake and during REM sleep, when dreaming happens. However, this switch becomes quiet during deep non-REM or non-REM sleep, allowing the brain to rest. During wakefulness, orexin system in the hypothalamus is the main center. It relates to the other wakefulness system centers related to sensations from emotion controlling centers of the brain, the external sensory organs like eyes, ears, nose, tongue, skin, muscle, joints, and as well as internal organs. These stimuli pass through the ARAS and then on to the gateway we call as thalamus and then ultimately relate to the cerebral cortex, creating the sense of arousal state of awareness and wakefulness. As you can see in the figure, when we are awake, these stimuli pass on frequently to make us aware of the surroundings. On the left side, you see the switch. At this time, the switch is on the wake state and there are related chemicals like norepinephrine, serotonin, acetylcholine and histamine. And in addition to note is an important feature that orexin system is the one which actually stabilizes this switch. When we are intending to fall asleep, the center for sleep initiation is the ventrolateral preoptic nucleus in the lateral hypothalamus. This is part of a switch that simultaneously inhibits the wakefulness system we call as de-arousal that in addition augments sleep occurrence. So once we are expressing our desire to sleep, the sleep center in the VLPO is activated and it initiates sleep in coordination with circadian and homeostatic mechanisms. It reduces the sensations being passed through the ARAS by gradually narrowing the gateway at the thalamus. This in turn reduces the awareness of the brain to various stimuli and sensations. This switch is further stabilized by orexin neurochemical in the hypothalamus. So there are additional chemicals that or neurotransmitters that help in falling asleep like adenosine, GABA, ghrelin and melatonin. Why this switch is so effective? This switch is self-reinforcing, meaning it strongly favors being fully awake or fully asleep. It avoids in-between states, which helps prevent confusion or poor quality sleep. This design makes sleep more stable and refreshing. This switch is essential for helping the brain stay asleep once sleep begins. It helps in maintaining deep, restful sleep. It allows quick and smooth transitions between sleeping and waking. When this system works well, we feel rested and alert at the right times. The theme of this presentation is that your brain carefully controls sleep and wakefulness using two opposing systems. One keeps you alert during the day, the other helps you pass into sleep and have a restful sleep. By working together like a toggle switch, they help maintain healthy sleep patterns and daily energy levels. These switches can be trained with various techniques and behaviors like cognitive behavioral therapy for insomnia, hypnosis, meditation, and more advanced techniques like mindfulness, to name a few. Adequate control can be achieved to obtain quantity and quality sleep and daytime wakefulness functions. Sleep and wakefulness, they are very complex systems in the body. I hope this presentation has given you some idea about these complicated systems that work together to achieve proper sleep at night and keep you alert and wakeful during the day. I would be waiting for your comments and suggestions so that I can improve my presentation and help you sleep better and function better during the day. Thank you.